Hey, so this is crazy. Um, just a quick story. All right, so I scheduled myself a colonoscopy. All right, I'm gonna get a colonoscopy done. A lot of people are like, "Oh, aren't you too young? Whatever, whatever." It's preventative, right? I believe in educating ourselves about our health, about our body, about what could be going on or what might be going on, if anything. If nothing, great. But just knowing the information is better than just, in my opinion, is better than just waiting for something to happen, right? So when I went, because you got to go see a doctor first, and the doctor schedules it for you, whatever. When I first went to the doctor, they asked me like 1,000 questions, and they just like put up a lot of resistance around me, even like around the idea of me even getting one. Are you sure? You don't. Doesn't really seem like you need one. You're not having any problems. And I was like, well, can't we just do this like as a preventative thing? Can it? Well, yeah, I guess. So anyway, so it finally gets scheduled, and it's on the schedule, and I call the health insurance, because obviously I want to know what my benefits are, right? I want to know what I'm getting myself into cost-wise, and I just want to empower myself with this information so that I can know how to move forward. I can know how to make my decision, right? So I call the insurance company, and they say, well, it depends on how it's coded. Now, if you know anything about health insurance, it's kind of a joke, first of all, but everything's about codes, right? So you got to make sure it's coded right. You got to make sure that you've got the right information, the right thing gets done, because if not, you can end up paying 3 times as much for the same thing, whatever. So they said, well, it depends on how it's coded. And I said, okay, well, what are the options? And said, well, if it's diagnostic, then it's one price, and if it's preventative, it's no price. It's free. And that got me thinking for a second. I was like, well, great, this is preventative. This should be free, right? This is awesome. This is exciting. And then I thought for a second. I was like, wait a minute. So if it's preventative and it's free, but it's diagnostic based, then it's going to cost me. So basically, if I have something wrong, it's going to cost me more. So, over the years, I've had the same policy now for 10 years. So I've spent roughly, $50,000 on this policy. And you're telling me that if I have something wrong, then it's going to cost me more money, basically. And it's a high deductible policy, whatever. So I said, okay, well, cool. So and then they said, well, you need to call and you need to confirm that the center that you're going to is in network, which I thought was odd, because I would think that the center would have confirmed that. And then they said, and then you also need to make sure that they code it right. I said, so I need to make sure that they code it right. Yeah. Okay. So I call the center. The center says, yeah, according to this, it's preventative, so you're not going to owe anything. I said, okay, well, how do I ensure that's how it gets coded? Well, sir, we're not going to know if that's how it's coded until the procedure is done, because we're not going to know until after the procedure if you have any polyps or whatever. Then we're going to have to do diagnostic. And if it's diagnostic based, then it's going to be a different price and it's going to be coded differently. I said, okay. I said, so I guess who do I need to talk to about like what that might look like? Well, you probably want to call the physician. I said, okay. So I called the physician. Physician says, oh, well, it looks like that they don't do preventative. So you're going to owe whatever it was, a couple $100 as a minimum, and then we'll bill you for the rest later. I said, well, that's not right, because that's not what my insurance company told me. So I called the insurance company back. No, it's it's definitely preventative. Your age, it's not a problem. I said, okay, well, can you tell me how much it is? So I said, so they told me this whole thing about it might be preventative, but it might be diagnostic, depending on what happens, apparently. And the insurance company says, oh, yeah, that's true, but we can't give you the price because we don't know the price. You have to call them and talk to their contract manager. Whoever their contract manager is, that's who can give you the price. So, make a long story short, I bounced and bounced and bounced and bounced. I called the physician's office twice. I called my insurance company twice, and I called the center 3 times. Now, this is why this is important. A lot of times, I can't tell you how many times I just want to give up and say, oh, well, let's just see what happens. Let's just see what it is. But that's unacceptable. That's absolutely unacceptable. For one, for myself, but what I'm saying is that for the system, that is unacceptable. Like, they need to have a clear-cut answer, a clear-cut, like, this is what you might have to pay. And so I get back on the phone. The last time I get on the phone with the center, just so happened that the same lady answered the phone that I talked to before. And she was getting agitated with me. You could tell she was really getting agitated with me. And this is where, a lot of times, my first gut reaction too is like, this person's so annoying. They don't understand what I'm saying. So let's just get mad at them or whatever. But that never works, right? So you got to stay super calm. You got to stay encouraging. You got to stay positive. And that's what I did. I just kept digging. And I said, well, she said, well, sir, I told you last time you called, we don't know. We don't know what the price is going to be. We don't know what's going to happen. We don't know any of this stuff because they haven't done the procedure yet. And I said, ma'am, I'm not trying to cause any problems. What I'm trying to understand is how you cannot give me an estimated price if this is not diagnostic, because basically you're telling me to go in and get this procedure done blindly and just accept whatever price is given to me, which is unacceptable. In what industry? In what other industry could I go buy a car and then 3 days later, 2 months later, oh, this is how much the car costs, by the way. Could you sign up for personal training with me, and 6 months later I'm going to say, oh, hey, by the way, this is how much it costs. I'm going to, back charge you now. Like, in what other industry can you just go walk in blind to something expectedly, like they expect you to just walk in blind, and then just pay whatever it is that they think that they deem necessary to be paid? I didn't say all that to her, but I just said, ma'am, I'm really just trying to get an understanding. I said, my insurance company told me that you guys should have a contract manager or somebody in place that can give me this specific range. It may not be the exact price, but there is a range of cost, no higher than, no lower than, that you will charge if it doesn't, if it has to be diagnostic or whatever. And she says, oh, yeah, this is what that price is. And then she told me what it was. And so, I tell you that story, I guess, today, number one, to kind of get it off my chest. But number two, like, we need to be more proactive with our health. I personally believe and feel that the system needs to do a better job, right? It needs to do a better job educating people about preventative measures. First of all, the fact that if they get in there and they do it and they find nothing and it's preventative, it's absolutely free. Like, that's amazing. But the problem is no one's being educated on the fact that that's an option. You can go get checked, and if it comes back, it's probably free. And I know not all policies are the same. Not everything is created equal, unfortunately. But that is something that we've got to do a better job at understanding and learning for ourselves. When we educate ourselves, we empower ourselves. When we empower ourselves, we make better decisions. When we make better decisions, we ultimately live happier, healthier lives. So I just want to encourage you today, I guess, if you've got anything, really anything in your life that you're unsure about, just ask questions. Stay positive, stay focused, stay kind. You'll get the answers that you need. Happy Monday.